I want to demonstrate for you how to measure a foot cap. I think a lot of people get worried about not being able to measure correctly or having mistakes and all. So let's just see if we can make this as simple as possible. Remember, I had my patient stand on paper. I'm going to have her stand again. I'm going to try to line up her foot. So where we are, that's good. Now, remember with the thigh high, when I was doing the opening, I did a diagonal measure across the metatarsal heads. Well, for the foot cap, or the toe cap, some people refer to it as, I want to go just straight across the metatarsal heads. So I'm going to have my patient lift her toes up and then stand. So bear down, and it's just stand. And we're going to just go straight across there. And I just want to get kind of what a true comfort measurement is. I'm not pulling too tightly or anything. And that number is 22.6. It's just slightly bigger than what we had for the slant opening for the thigh high. 22.6. Now, I find also for toe cap, many people make a mistake of making this way too short. I like to go up on the foot as long as possible, but as we have our patient, let's have her bend. See this tendon here is tibialis anterior. I don't want to cut into that tendon, but I want to just come short of that. So instead, what I'm going to do is just come along here, and I'm going to take a measurement there on the side there, and on the side here. And later then I can take a look at what my lengths are for the medial as well as the lateral lengths. Now let's take a look at what the circumference is of this measurement, which is referred to as the CA1. So I'm going to slide this up, step down, and let's come around here. And this measurement is just a true, a measurement that's just comfortable measurement. And I get 23.4. So I'll put 23.4 at the CA measurement. Now I have enough information here for getting my medial and lateral lengths. What we now need to take a look at is the length of the toe caps as well as the measurements at the base and at the end of the toes. So to do that, first off, you can take one option, you can take a business card and you can just stick it in. You don't want to cram it in the web space for length. So let's work on our lengths first. But you want to just take this, so it will go in, and at that point I can take a measure and go, I would just want to go to the end of the toe, and I can take a measure of what that would be, and then I can take a measure. This is one way of doing it. And this number would be just about 4.2 for the length. Alternatively, you might have one of these Elverx cards from BSN Jobst, and you can do the same thing where you just enter in and go, and here I get so 4.2. So there's different options that you have available, but if you don't have one of these cards, just know you can take one of your business cards and get what that length would be. All right, next I'm going to record 4.2 for my length there. My next length, you always want to choose your shorter side of the toe cap. Oftentimes though, I can go this side to this side. I'm going to go here, it's just a little bit shorter on this side. So I'm going to take this, and you go all the way to the end, and we'll take what that measurement is here. I'm going to take this and just record it, and you know what? It looks just to be exactly for what the big toe was. So I'm going to say 4.2 for that one as well. For the next two, you're going to take a look at the shorter side, and this side tends to want to just see which side is going to be the shorter, because you don't, for her toes, it's pretty similar, but for many patients, like this is 3 on this side, and this is about 3.2 5 on this side. I'm gonna go with the 3, just so it doesn't cut in too much here, so we'll just say 3 for that length. For the next length, you can see there's quite a bit of distance going all the way down to the 5th digit, that the lateral side of the 4th toe would be a lot longer. So I'm going to take the measurement of the 4th toe here, and that number is about 2, it's hard for you to see there, but I'll just tell you it's about 2.6. Now, our toe caps often are most comfortable, and they often don't put a 5th toe in, but you do need to provide measurements for the 5th toe. So we're going to take a length of what that 5th toe would be, and I'm going to say that is 2.0. And I'll show you that later, and we'll also talk about an opening, because they give you options for openings, and I usually choose the largest opening. Sometimes that's kind of a question as do I go with 0.5, 1.0, or 1.5. I usually opt for the 1.5 to give me the most leeway for around the little toe there. So now let's take a look at the measurements. And these measurements of the circumference of the toes are measured at X is at the base of the toe, and Z is at the end of the toe. And these are measurements where you're never going to pull super tight. You just want to get a comfortable measurement where you just come around and just go straight across to give us what our true comfortable measurement is. Remember, we have that law of Laplace, so when you have a smaller circumference or a radius, the pressure gets a lot harder, so you just don't need to be too tight or too aggressive. I mean, certainly I would never pull tightly here, but just do a nice loose measurement here, and that's going to give me a measurement here of about 8.4 in a loose measurement at the base of the toe, big toe. For the end of the toe, I'm going to do the same thing. I want to go just to the point before it starts falling off, and I'm going to take another loose measurement, which would come up to about 7.8, 7.9. And my little trick to keep it so that it measures well is add 2 millimeters to that measurement. So for all of your Z measurements, add 2 millimeters at the very end. And that just helps it not be too tight at the end of the toes. So again, I measured 7.9. So I'm going to make that measurement 8.1 at the end of the toe. So now we've measured for the big toe at the X and the Z measurement. So we're beginning with the second toe. And to do this again, we just want to use a gentle, loose measurement. And I'm going to say that number is 6.3 at the X measurement, 6.3. And then at the end of the toe, just before you have to cover the nail and go up to the very end, that number comes at a loose measurement at 5.1. But for comfort, I've just found if I add 2 millimeters and make that 5.3 at the end. My next measurement for the X of the third digit here, third toe, is that comes up at 5.5 at the X measurement. And the Z measurement, again, I'm going to go over the toenail and I just do kind of a loose measurement of whatever closes up there. That number comes to 4.7. So again, falling in line, I'm going to add 2 millimeters and make that 4.9. For the fourth toe, I'm going to do another loose measurement at the base, at the X, and that number comes up with just a nice loose measurement, 5.1. And then at the end of the toe, this measurement comes up at an even 5.0. and I put that in at 5.2. And with all toe caps, regardless if you don't have the fifth toe coverage, you do need to provide these measurements. So I'm going to do a loose measurement at 5.0 for the X. And at the very end, I'm going to do, this one is 5.2 at her end, but I'm gonna make it 5.4. I'll add the 2 millimeters, 5.4, even though on the form it'll have a small toe open, and I always opt for the 1.5 opening. Also, there are different kinds of toe caps. If you happen to be using the Jopes form, there's a form called Elverex Plus. And what's nice with that one is it doesn't have the seams that you have in there. And that's called Elverex Plus. And with that one, you do have to just make sure you mark that box if that's what you're choosing. Now, if you have a patient who needs a lot more compression, I think with the Medi brands and with the regular Elverex, you might get a little bit better compression on those toes. But many patients find that the seamless Elverex Plus works well. It's just, you have to find out what works for your patients. And with certain brands, you might find you get better containment that works for one patient versus what works for another patient. So now in double looking back over what I have, if this were my patient's first option, first time of putting a toe cap on, I would always opt for class 1. If I found she'd been wearing it to class 1 successfully, I might opt the next time to go to a class 2. But often for my very first time, I'm going to choose a class 1. And I believe we've been using class 1, and that seems to have worked okay for my patient here. And with that, I'm going to take the measurements that I took on the lateral side. So that's the last thing we have to do to finish up the toe cap. So we have lateral measurement we took to just at the base of the tibialis anterior. This measurement is 7.0. Now put that on my lateral measurement. And the medial measurement is actually going to be about 9.5. And then with that, I think that finishes it up in terms of measuring for a toe cap.